So we'll today discuss about diabetes in pregnancy, which is extremely important primarily for fetal outcomes. So diabetes in pregnancy can exist in two forms. One is a pre-existing disease which the woman would be having before she is conceived, which she may or may not be aware about, and the second is a gestational diabetes. So for all women, the guidance is to undergo a glucose testing in the first trimester, in fact at the first antenatal visit, to diagnose any pre-existing diabetes which can be treated as soon as possible. So if this test turns out to be normal, a second test is then performed between 24 and 28 weeks of gestation to diagnose gestational diabetes. Now gestational diabetes is generally secondary to the placental hormones which are secreted in pregnancy. They lead to increased insulin resistance and abnormal glucose tolerance. So the prevalence of gestational diabetes is around 15 to 20% in India, and it poses certain risks to the fetal development. The major risks for diabetes in pregnancy include organ defects, which is usually seen in pre-existing diabetes. The major defects could be cardiac defects, neural tube defects. Subsequently, in pregnancy, if the glucose control worsens or stays poor, there's an increased risk of preeclampsia, of polyhydramnios, which means an increase in amniotic fluid, of macrosomia or an increase in fetal size. Gestational and pre-existing diabetes both can lead to preterm deliveries, shoulder dystocia or birth trauma during delivery. In fact, even respiratory distress. During delivery, if the glucose is uncontrolled, the newborn can have hypoglycemia, they can have prolonged jaundice and some electrolyte abnormalities. So basically, there are implications for every stage of pregnancy, hence it is important to maintain a good glucose control throughout pregnancy. Now, remember that the diagnostic criteria for diagnosing gestational diabetes are different from that of overt diabetes in a non-pregnant woman. Also, the treatment targets are different for women in pregnancy. In fact, the options available to treat diabetes in pregnancy are also limited, with insulin injections being the safest therapy. With good control, the risk of complications to fetuses are minimized, but all women who have gotten a gestational diabetes, even though most of them normalize glucoses after delivery, but their lifetime risk of getting a diabetes is certainly higher than the general population. So there is this guidance that all of them should be tested again with a glucose tolerance test around 1 to 3 months after delivery and subsequently annually thereafter. Thank you.